Hi, guys, and welcome back to Baby Wearing and Breastfeeding, Nurturing Miracles, the podcast where we talk about everything baby wearing and breastfeeding, specifically tailored to our medically complex kids. I'm your host, Megan Pa, and today we're going to be talking about building a medical team. So I've got our guest host, I'm really excited to talk to, Rebecca Hinder. She's a pediatric nurse practitioner. She has been a NP for 7 years, and she's also a mom to two boys. They are 5 and 2 now, which I actually can't believe, because we met at a lactation consult when your 2-year-old was a baby. Yep. So I can't believe it's been 2 years. I'm really excited to have you on. I appreciate it. So can you actually tell us how you became a nurse practitioner and what led you into this field?
Yes. So ever since high school, I knew I wanted to go into the medical field and kind of zeroed in on nursing and was interested from pediatrics from the get-go. And I went to George Mason for my undergrad to go to nursing school. And coming in my senior year, I was able to get a job as a medical technician at Inova Children's in their heart and kidney unit. It's like a step down IMC unit, and I loved it there. And I was able to get hired as a nurse after I graduated, and I was there and worked there for 5 years. And about 2 years into that, decided I wanted to go back to school to become a pediatric NP, and went to school at Drexel, and then got a job in primary care pediatrics about 7 years ago. And
I'm so curious. So you took the MP program while you were still working?
Yes.
How was that, navigating working and going back to school?
I did not have kids at the time, which is what made it work. But I did go part-time at the end when I was doing clinicals. But it was a busy few years, but I made it.
I can imagine. Oh my God, that's amazing.
Yeah.
Good for you. I didn't know that. Very cool. Mm-hmm. So yeah, so you knew that you wanted to do pediatrics. So you got your NP. And then tell me a little bit about the process after. Did you know that you wanted to work? So did you go straight into a pediatric office, or did you know you wanted to work out of hospital? Did you ever think about working in? How did that work for you?
Yes. So my program specifically was a pediatric primary care program. So it geared me towards primary care. So I knew coming out of school that's what I was looking for. And so I went right into a primary care practice a few months after I graduated, and I've been there ever since. And love it.
Perfect. Thanks for explaining that. Yeah, for us people that don't know. Yeah. So okay. Can you tell me, in your words, what is the specific role of a pediatric nurse practitioner? So what's your role? How is that different from a pediatric MD? Could you just share a little bit more about that?
Yes. So it is very similar to a role of a pediatrician. I think the role can vary depending on the culture of the practice that you're in and the setting, whether it's suburban or rural or whatever. But basically on a day-to-day basis, I'm caring for kids from newborn to age 21, doing well visits and kind of acute sick visits, and then managing certain chronic illnesses like asthma, eczema, ADHD, things of that nature. In terms of personally how things kind of differ in my practice, pediatrician versus pediatric NP, I would say a lot of the pediatricians at my practice tend to take on more of the chronically ill kids, more of the medically complex kids, although that's not a rule across the board. And they tend to do a lot more mental health work as well, because that's such a big need. But I think that's very practice specific in terms of what the differences truly are. It's mostly just the educational tract to get you to that office is a little bit different.
Yeah, that's interesting. So you mentioned you see, especially this time of year, right? Like a lot of asthma patients. I'm imagining you see a lot of colds, viral stuff like
Yeah.
flus. What are some of the other really common things that you see in kids that make up your like day-to-day practice?
Yes, I would say in terms of complaints, you've got a lot of abdominal pain, constipation, eczema, um, strep, obviously COVID, flu, all RSV, those
Mhm.
types of things. You've ADHD, a lot of kids with anxiety, depression. So it's a good mix of like acute care, kind of self-limiting type illnesses, and more of the chronic type complaints that are an ongoing type of
Yeah.
management.
Yeah. I imagine for some of that stuff you do refer out. When you do that, and also if you do see children that come in that have more complex issues, when you are setting up referrals, what does that look like for you? Do you walk the parents through that? Do you set up the connections for them? Do you set up their next appointments, or do you just provide them, like, how do you do it? Do you provide them with a list of resources? Could you talk more about like what happens when you've got a kid that comes in that doesn't have your everyday common cold or asthma?
Yes. I think the best example would be we'll see like newborns that have been discharged from the NICU,
Mm-hmm.
and maybe they were, in addition to being premature, maybe they have a kidney issue and a heart issue, and some other things. And so the way that I approach them in like an initial visit is kind of looking at the whole patient and kind of looking system by system. So cardiac, respiratory, renal, all of those things to see, okay, what are their problems? Okay. And what's the solution or the next step for each one of those individual like medical problems. So I would sometimes, like in that specific example, the hospital will have already set up follow-up appointments for which specialists they need to see afterwards. If not, then I will give them a list with, you need to schedule with cardiology. Here are the different numbers to call depending on your insurance. You need to schedule with nephrology, that type of thing. Here are those different numbers. And sometimes we'll have parents that are having difficulty getting in to their appointments. And we have at our office an amazing triage nurse kind of contingent in our practice, and they can help to actually call some of the offices and kind of get the ball rolling, or even schedule appointments if the patients are having trouble getting through, or if there's a language barrier, or
Yeah.
something of that nature. And the other thing I think about with being in primary care pediatrics is like the developmental piece. So a lot of kids that are medically complex will have be at risk for developmental delays of some sort, whether that's feeding or fine motor skills or gross motor skills. So addressing for that. And I love early intervention, I think that's what they call it in Virginia. And then that goes into child find, but they can be an amazing help with getting patients in even before some of those delays were to actually develop or manifest, and connect patients with affordable or free therapy for that medically complex kid, which is great.
Yeah. So what I hear you saying is that you're literally, when you're seeing a patient, you're looking at all their body systems. You're going down through each system, and whether you have like a physical checklist or a mental one, you're checking off like,
Mhm.
okay, have we set up and scheduled you with this person that you might need to see, or this person? And so in that initial visit, you're covering all the bases. And
Yeah.
you mentioned that most often that you're starting off with babies that are coming from the NICU that have these, that are needing these follow-up appointments. Now with infants, I imagine like they're in the NICU, their feeding habits are pretty established, but do you have a discussion about feeding and whether or not a parent is formula feeding or breastfeeding, and do they need any help with that?
Yes, for sure. I would say, especially in that specific example with newborns, feeding is the main thing I'm going to focus on, in addition to kind of what's their care management long term. So yes, assessing, is mom breastfeeding? Is she pumping? How often do they have, questions that they want to address the lactation consultant? How's their supply? What formula are they on? Oftentimes they'll be, if they're premature, they will be on a special preemie formula. And then sometimes they'll need like a multivitamin or something like that as an added nutrition piece. And sometimes they need like feeding help. So if they're bottle fed, sometimes like a speech and language pathologist can be helpful. If they're breastfed, I refer so many of my patients to lactation because they can be so helpful to patients.
Yeah. And then what does follow-up look like for you? And this is actually something I've always been curious about. The practice that like we're with is actually really good. They're always, they're automated emails, right? Like, but they're always sending emails like, have you had your flu shot? Have all your kids had their flu shot? Your kids are due for their annuals. But, something that we don't get, and maybe it's out of your like purview, is the pediatrician. Do you guys ever follow up with, like just randomly checking in if you have a kid that's like medically complex, like, or do you just kind of stay in your wheelhouse, which is like checking in for annuals and vaccines, depending on like how old the child is, right? And my question is like, once you've had that initial visit and you've referred them out, is it now kind of like you've passed the baton? How does that, what does that approach look like?
Yes. I would say that oftentimes kids who are medically complex, one of the main issues that they have is weight gain. And so oftentimes we will see patients back, especially newborns, but even beyond that, for weight checks, kind of in addition to their regular visits. And sometimes the regular visits, if it's a baby, they're coming in, at the 2-week mark and the 1-month mark, so we will still be seeing them fairly regularly. But if it's an older kid, oftentimes we're maybe seeing them every, 3 to 6 months to kind of check their growth parameters. So we're not just waiting, every year. And then we definitely have in our like electronic medical record system, kind of notes for other providers if they're seeing the child at the next visit, of, okay, they need labs at this point, they need, this kind of a game plan overall for that patient, and refer to the specialist. We always keep a list of patients we've referred places and follow up via text or letter saying, hey, have you gone to the specialist yet? And we try to make sure we kind of close the loop, make sure they went, get the note, and that we are able to review it. And definitely I'll put little notes to be like, okay, I need to follow up with this patient. I'm going to call them in a week or in 2 weeks. Or sometimes just making sure that the patient follows up, because I know they've got a lot going on and they're trying to juggle multiple appointments. Sometimes when I see them, if I'm like, okay, I want to see you back in a week or 2 weeks, I'll just schedule them right there and then, even before they leave the room, so that we have something on the calendar and they don't fall through the cracks, so to speak.
Yeah. So that, to me, your response to me, that's very, like, you're definitely on top of things. And I wonder, do you think that is like provider specific or practice specific? Because, again, I only have my own experience to go by, but there have been times where, like, we have to go out of network and like our providers, like, their notes don't match. And so then it's up to me. It's up to me to fill in my pediatrician with any new information I've learned. Like, they don't really follow up with that. And I'm wondering if in your opinion, that's definitely every practice is going to handle that differently. Every provider is going to handle that differently, even within the practice, on how well they're kind of following up with parents, based on their child's care and the other doctors they're seeing.
Yeah, I completely agree. I think that it is time consuming to
Yeah, I bet it is.
in a busy pediatric practice, you're seeing, anywhere from 15 to 25 patients a day. And
Mhm.
so oftentimes things can fall through the cracks, or you can forget to kind of follow up on things, or it's hard to read the specialist note that is attached to the patient's chart. And sometimes it's a struggle to do that, and then to dig it, go request the records and find it. It can be very challenging.
Yeah. I'm
So I
glad
do like
that's actually really good to hear. And I'm glad that you said that because I do know, like I have a special position that I've kind of been on both sides of it, not
Mhm.
as like, a pediatrician or anything, but knowing how busy that the medical providers can be, that you're seeing 15 to 25 patients a day, and wanting to be able to follow up with everybody, but it almost at some point becomes impossible, right? So I
Mhm.
think the message here for people and parents listening is that you have to be an advocate for your child. You
Yeah.
have to really take charge, be on top of their healthcare, be on top of the all of the providers and all the appointments that they're supposed to go to.
Mhm.
So parents really have to take an active role in that, and sometimes that even looks like connecting the dots between the providers. Because I know I've had to do that. I've absolutely had to go to many nephrologist appointments and tell the pediatric nephrologist, well, that's what the pediatric urologist says. So then
Mhm.
you two compare notes
Mhm.
and then we'll go from there.
Right.
Yeah, and part of that is because they're not in the same network. But I think that that's an added responsibility for parents, like an added layer on all the things that they have to do is they have got to
Right.
be on top of their child's healthcare and all the people on their medical team.
Yes. No, it's a big job. It really is. And I've seen some parents of medically complex kids have like whole binders, the ones that are really organized, that they'll, and not everyone can be like this, with
No, that's
every,
a type A parent. I don't do that.
with tabs, with all the specialist notes, and they take it to every appointment, and they're taking notes at every appointment, but not
Impressive.
everyone can do that. Like it's really hard. It's really challenging, in addition to just making it to the appointment, actually being able to synthesize all the information that they're giving you so quickly, and
Yeah.
being able to then repeat it when you go 3 months later to your pediatrician or
Yeah.
another specialist is very challenging.
Yeah. Well, that's pretty impressive. Binders. That's actually good to know. Yeah, that's a good tip though. So for people listening, organization with binders and like tabs. That sounds like
Yeah.
the way to go.
That's the minority of patients. But when I did see it, I was like, wow, that's amazing. This is really good.
Yeah, I love it. That's really great.
Goals.
I actually have I'm wondering too, because you're in Northern Virginia, we are very, like culturally dense. We've got a lot of great different cultures coming in.
Mhm.
So, do the pediatricians here and the nurse practitioners, do you guys take any kind of trainings that help you navigate different cultures and their preferences and wishes when it comes to their child's medical care?
Yes, I mean, we do have like required cultural competence training for sure, um, which is definitely helpful. I think though, just kind of learning on the job as you talk to families, just during a regular wellness checkup, you're learning it's a very diverse area, and you're learning with every family, every patient that you see, kind of the way that they live their life and the things that they value and the holidays they celebrate, and what they do in their free time, and what their dietary restrictions are. And so I feel like a lot of it, for me at least, has been kind of learning as I go, as I'm like actively listening to patients about, okay, what's important to you, what are your values, uh, what things are you prioritizing, how does the day-to-day work in your family, and that's super important, because I've seen a lot of different families kind of approach their child's care very differently, kind of depending upon what works for them, and I think it's important to look to them and really listen to them, because it's hard to know the nuances of every single
Yeah.
culture, and especially the added complexity of a language barrier. We at my office we have a great translation service, but it's limited in terms of you're talking to somebody on the phone as they translate to your patient, and things can get misconstrued or lost in translation sometimes.
Oh, for sure. Yeah, that is tricky, navigating the language barrier. Yeah. Yeah, and it's gonna be different in the office. Like if you're in, at least in my experience, if you're in any hospital in Northern Virginia, and I can't speak for hospitals outside of Northern Virginia, but we've got that great phone system where you can like pick up the phone and you've got an interpreter in like 30 or something plus different languages that
Mm-hmm.
can perfectly interpret for you. So
Right.
the pediatric offices don't have that.
Right. And we are getting it, but it's not quite as, yes, it's maybe not at the same level sometimes in terms
Yeah.
of the access. Yeah.
Yeah, no, that makes sense. What about ethical considerations? How do you handle ethical dilemmas, like in a team setting? So I imagine that you're going to loop in some of the other providers in the office, but how do you go about handling that?
I think with most, I was trying to think of a specific example, but I feel like with most ethical considerations, I think it's really, you really have to look to the patient. You really have to listen to them or listen to the patient's family in terms of, okay, what are you valuing here? What are your priorities? The one example that I could think of was when I was in school, I did a cardiology rotation at an NP school, and one of the moms was coming in for a fetal echo. So she was still pregnant. The baby had some sort of genetic defect that had a very significant heart defect associated with it, and the baby wasn't forecasted to survive much long after birth. And obviously there's different treatment options that were available to that mom, and the mom chose to continue to carry the baby to full term, labor, have the baby, and then provide comfort measures for the baby. And so I think that truly just listening to, okay, what is the parent's preference here? What's going to mean the most to them? And listening, and then kind of advocating for them to the other members of the team as you kind of hear what their preferences are in a certain situation.
Yeah.
Yeah.
Do you ever find it hard because you are a mom too to put aside like that? Well, how do I want to say this? Like, this is what I would do piece, and just be there and listen to your patient and provide them with the necessary tools that they need that will support their wishes.
Yes, for sure. I would say in a sense, every patient that I care for, I try to treat them as if they were my own child in terms of trying to provide this, the utmost level of care. But at the same time, they're not my child. And sometimes the parent will have different preferences or will make different decisions. And there is freedom in that. I mean, there's always certain things that there are safety issues or where I'm going to strongly advise one way or the other. But there's a lot of other issues that really, there's a lot of right ways to do things, and not every family wants to do the same thing, or the thing that I might think is the best, and so exactly releasing them to be able to be like, hey, if this works for you, this is perfectly safe, this is perfectly acceptable, that's okay. And really they have to be comfortable too with the decision or whatever it is, they because you don't want to just coax somebody into something and then if there's a bad outcome or whatever, like that's not a good way to approach it. Making sure that they're comfortable, and even if you're comfortable with something and they're not, respecting their decision in the meantime.
Yeah, I definitely could see that it could be hard, like one way or the other to help a parent navigate through that.
Yeah, it's quite a balance, I feel like.
Yeah.
Yeah.
Absolutely. So this has been really helpful. So I have thoroughly enjoyed hearing the way that you approach what would happen if you had a patient that was medically complex. You go through every body system, you make sure that all the bases are covered and that they are seeing the providers that they need to see. And the really great thing about the office that you work for that I've heard that you told us about is that you've got somebody in there. And could you tell me again what they were called? It's not like a case manager. What did you, the triage
Yeah.
nurse? Is that
We have
it?
triage nurses. Yes,
Yeah.
yes. And we do have care managers as well.
Care
That
managers and
also
triage.
help.
What's the difference
Mhm.
between the two? The triage nurse and the care managers.
So our triage nurses, they will take phone calls for nurse advice, for our patients in our practice. However, they also help with referrals and can also help with scheduling appointments. The care managers oftentimes will manage more of the patients with chronic illnesses, whether that's obesity or substance abuse or things like that require referrals to certain, clinics in the area or recheck appointments. Those sorts of things. They will do a lot of that. Or our babies. It used to be before the new RSV vaccine. There was an old RSV vaccine
Yeah.
called Synergist, and they would coordinate that for some of the babies with heart problems and respiratory conditions and stuff.
Yeah. So, okay. So that's what we're going to do when a baby, the first initial appointment, right? So you're going to go through all the body systems. You're going to make sure that all the referrals are being made. And then we have either the triage nurse or the case manager that's going to help that person then navigate setting up those appointments. And then as far as follow-up, if it's a medically complex baby, they're probably, and depending on the age, right? So if they're younger, they're going to be seeing a lot more because babies are going to be having 2-week visits and then 1 month, 2-month visits, and they're going to have all those checkups. But some of the medically complex babies might be seen more for weight checkups. They might be seen more for blood draws and labs. But then I imagine, especially once they get past a certain age, and we're out of that time frame where they're being seen a lot, then the follow-up from your point of view or from your position is just going to be blood draws if they need be, right? Or their annual visits. So what age does that happen? What age do we start to we've had all of our vaccines. We've done a lot of our checkups. When do we start to kind of slow down with the
Slow
pediatrician?
down. Yep. So the annual visits start at 3. So at 3 and up, you're only seen yearly. If you don't have any other,
Right.
concerns or whatever. And so for a patient who's just coming in for their annual checkup, but they're medically complex, I usually try to review their chart to see, okay, what specific diagnoses do they have? What specialist notes do we have? Oftentimes the specialist will send us the note, or we can obtain it electronically, and then reading over that to determine, okay, have they made their next appointment? They said they needed to be seen in 6 months. What meds are they on? Oftentimes they'll note any restrictions that the patient has or any vaccines that they need or should not get, based on their treatment plan. So it's really just kind of springboarding in addition to the regular wellness visit, springboarding off of those specialist notes. We rely heavily upon those to kind of determine if anything else is needed, fill in the gaps of what we would provide during just the regular well child check at
Yeah.
5 or whatever.
And I imagine too, when you see that person, not only are you reviewing the specialist notes, but you're asking the parent,
Yes.
please, from the last time we saw you until this time, catch us up,
Mhm.
what's happened, who
Yes.
have you seen, all of that kind of stuff.
Yep. So we ask every patient for that comes in for an annual wellness visit, what specialists are you seeing? What medications are you on? Any surgeries, any hospitalizations, reviewing all of that every year just to make sure we're up
Yeah.
to date on the
Yeah.
patient's health plan.
Yeah, no, that's awesome. That seems very thorough. It's very comforting to know that what your process is and that, that kids are being all the boxes are being checked, right?
Mm-hmm.
And then let's be real. In reality, I know as a mom of 4 kids and 3 of them are perfectly fine and healthy. Like you're seeing your pediatrician a lot more. And it's not just because your kid's been running 102 fever for 3 days. It's also because they tripped and hit the baby gate and knocked out a tooth. And, and then the other kid was at the trampoline park and broke their arm over the summer. So like,
yes,
you're seeing your pediatrician a lot. So there's other opportunities throughout the year to check in.
For sure. Yes, exactly. Yes. And not losing sight, as the primary care pediatrician, if someone's coming in for a fever, not losing sight of, okay, what's their weight today? What meds are they on? How are they doing overall? And, what chronic diagnoses do they have that could be involved?
Yes. I'm so glad you say that, because that's incredibly obviously important and pertinent to when you're doing a health eval, because obviously, like the very first thing that we get asked when I bring, my youngest in, if he's been running a fever, is, any change in his bathroom habits, obviously, because he's got kidney disease. Like, how's his urine output? Like, has he been drinking a lot of fluids? Like all of those questions. They're going to run tests for UTI. Like even if we know, and I tell them, everybody in the house has had the flu this week, I am 99.9% sure he has the flu, we are still running a test to make sure he doesn't have a UTI. So I imagine that you guys do stuff like that for other health issues across the board.
Yes, for sure. Yes. And oftentimes the specialist will kind of note that stuff at the end of their specialist note. They'll say, if this patient has a fever, they need a urine analysis. If this patient has a fever, they need to go to the hospital, or even get
extra IVs. We've had it where it's depending on the age of the child, which also will come into play. Under a year, and again, this is going to be very case specific, but under a year, if we're going in with a fever that's been a while, like he's getting IV antibiotics while we're there. Like, we're going to start off with that, and then we'll get some to go home. And then as he's progressed and gotten bigger and better, it's a step down from that. But I'm sure all of that stuff comes into play.
For sure.
Yeah. So this has been really, really helpful. I have really enjoyed talking to you and finding out the process for how you kind of set up a parent's medical team and even put people into place to help them schedule those follow-up appointments. So what would you say in your past 7 years has been your most rewarding experience working as a pediatric NP?
Oh, that's a good question. I think just seeing, there's, several patients that I've had that I've seen since they were a newborn, or close to that. And then just seeing them grow and mature and develop, and getting to know their families as I see them for different visits, and coming alongside them, being a cheerleader and an advocate for them. I think that's the most rewarding part of it, honestly.
I love it. That's so great. Yeah. Seeing them grow, because when you get to see them from like newborn on, that's really awesome, especially when they do well. Yeah. How do you see the role of medical teams, pediatric medical teams evolving? We are going into a really interesting future, and we talked about this before, we jumped on here about, I mentioned a little bit about like, artificial intelligence and like AI. And I bring that up in a medical sense, in the sense that like, for example, getting into like medically complex kids, Tyson's next surgery, like the doctor's using like robotics to go in and do it. And like, it's just, it was, when she was talking to me about it, I was like, what? It's crazy. So how do you see that? Like, how do you see the medical teams changing as we go into the future?
Yeah, well, there's one patient that I'm managing currently who has a complex congenital heart defect that requires, 3 different surgeries, but they're monitored very closely. Kind of, they get one surgery done as a newborn, monitored very closely until that second surgery. And so they're they are being cared for through UVA hospital, and they have like a app set up basically that the mom can put in the baby's weight and their heart rate and their oxygen level each day, and put all that information in, and then the whole medical team, has access to that and can review that. And that's really important in determining, okay, are they getting enough calories? Are they growing enough? Are their vitals stable, or do they need surgery sooner? And so I see cool. more. Yeah. I mean, with having a smartphone and having all these apps, I can see a lot more apps that can help kind of connect the parent to the specialist or the medical provider, and then connect the medical kind of specialist together for more of that shared decision making.
Yeah, that is absolutely fascinating. Like, I just think that is the coolest thing. I mean, like, and more to your point, like I've definitely seen people with monitors where it's like monitoring their heart rhythms, and it's going directly back to their cardiologist in real time. Yeah. So that is just so cool. And as a parent, if you have a child or an infant with a heart problem, like, that's really reassuring. That they're being monitored in real time, because, I feel like it takes a little bit of the stress off. So that's really, really cool. Yeah.
For sure.
Thank you so much for being here and for your time. It's been so fun to like catch back up with you and learn more about your practice and how you approach, teen care. So thank you guys so much for listening. We are going to be back every week. So in the next upcoming episodes, we're going to be talking to more medical providers. And I really hope that you guys can join in, that you've got something from today's conversation, and that, you guys are really following along every Tuesday. Thank you so much for joining us today, Rebecca, and everybody have a great week. Thank you all for joining us on today's episode of Baby Wearing and Breastfeeding, Nurturing Miracles. I hope you found our discussion enlightening and that you leave feeling supported and empowered. Remember, you are not alone on this journey. Tune in next week for more insights and conversations that connect us all in the shared experience of parenting. Until then, take care and cherish every miracle with your little ones.